keep it
Prostatitis is inflammation of the prostate gland. You can have pain from the inflammation, which could also cause difficulty in passing urine.
It's caused by 4 different basic types: acute bacterial chronic bacterial prostatitis, chronic prostatitis, or asymptomatic inflammatory prostatitis. Bacterial is the most common, and it causes edema and inflammation, but any bacteria that causes a UTI can cause it. Sexually transmitted infections can cause this. The prostate may become infected with bacteria from infected urine refluxing into the bladder, bacteria in the blood or lymph supply glands, or surgical instrumentation or other forms of urethral trauma.
And then there's several ways to prevent it. One is like just having safe sexual practices and like being cognizant with your partners. You want to make sure you're fully emptying your bladders, because that just helps in fighting UTIs, which can cause it as well. And you want to avoid drinking excess alcohol.
The signs and symptoms would be the urgency, frequency, hesitancy, dribbling, dysuria, low back pain, and other symptoms may include nocturia, fever, and chills.
Complications can be a complication of acute bacterial prostatitis, and it can be caused by urinary retention, or if the prostate is extremely swollen, the bladder may not be completely emptied. Another complication can be erectile dysfunction. Ascending infections, prostatic abscesses, epididymitis, and prostatic stones are also more serious complications that are very rare.
And then we have some different diagnostic tests that you can do, and it's all based on symptoms. So the first test that they normally perform is a digital rectal examination of the prostate. The healthcare provider will examine the prostate gland with like a lubricated finger. It might include a warm, irregular, swollen, or painful prostate. A urine culture test for bacteria. The examiner might massage the prostate gland to express it, to express prostate secretions, which can then be tested for like bacteria, and they can look at the white blood cells.
Okay. For therapeutic measures, there's antibiotics, anti-inflammatory agents, stool softeners, warm sitz bath, dietary changes, not to have any spicy foods or alcohol. Yeah.
Some relevant nursing diagnoses can include urinary retention, deficit knowledge, and acute pain related to prostate, cleanliness, stones, you name it. And our source is the book.
F.A. Davis, Understanding Medical Surgical Nursing.